Hello everybody, this is Dr. Mehtab, first year resident in Community Medicine Department. In the previous video, we have discussed about the vectors of public health importance. In this video, we will discuss about the insecticides, their mode of action and application, and we will briefly discuss about the MCQs on both the topics. So first of all, the classification of insecticides. They're classified into natural and synthetic. Then these natural are classified into plant-based and mineral oils. Pyrethrum and azadirachtin comes under the plant-based insecticides, and synthetic is classified into inorganic and organic. Organic insecticides are classified into organochlorines, organophosphates, carbamates, and pyrethroids. DDT and benzahexachlorine comes under organochlorines. Malathion, temifos, phenethion, dichlorvos, phenitrophenone, primifos methyl comes under organophosphates. Propoxur, bendocarb, carbaryl comes under carbamates. Deltamethrin, cyfluthrin, bifenthrin, lambda cyphalothrin, permethrin comes under the synthetic pyrethroids. So we will discuss about some of the important insecticides in this video. So pyrethrum, it's a natural contact poison derived from Chrysanthemum cinerifolium. The ready-to-spray solution contains up to 0.1% of pyrethrins. It acts synergistically with DDT. So dosage recommended by WHO for combination DDT and pyrethrum. Pyrethrum extract is 1.6% and DDT is about 3%. It is a nerve as well as a contact poison. Mineral oils. Kerosene, crude oil and malarial oil are used as insecticides. These oils suffocate and poison the aquatic stages of the mosquito. It also shows synergistic action with DDT, HCH and other insecticides. Then DDT full form is dichloro diphenyl trichloroethane. It's an organochlorine synthetic contact insecticide. Residual action lasts up to 18 months. For indoor residual spraying, insecticides in use are DDT 50% wettable powders and malathion 25% wettable powder and other synthetic insecticides. Then BHC, benzahexachloride or HCH, these are organochlorine. It's a synthetic contact poison. It's a chocolate color powder with musty smell. It is an irritant, so irritating to the nose, eyes and skin. Dose is 25 to 50 milligrams. Gamma HCH per square feet. Then malathion. Malathion is an organophosphates in insecticide used in ultra low volume spray, available as water dispersible powder form, and dosage is 100 to 200 milligram per square feet every 3 months. This is the least toxic compound of all the organophosphate insecticides. Abeta temifos is an organophosphorus compound, synthetic contact insecticide. It also acts as a larvicide. Dose is 0.1 kg per hectare of active ingredient. It is usually used in drinking water cisterns. Dosage shouldn't exceed more than 1 ppm. Low toxic compound. That's why it is used in drinking waters. So soluble in petroleum solvents. Phenethion, also called as Batex, is a water dispersible powder available containing 20 to 40% of phenethion. It is insoluble in water. Dosage is 100 milligram per square feet. It's a powerful larvicide. And propoxur. So it belongs to carbamates, inhibits acetylcholinesterase enzyme. So it causes neurotoxic effect on insects. Paris green. Dust Paris green on swamps and ponds. So it's a stomach poison. It contains 50% of arsenous oxide. It is not soluble in water. It dissolves with ammonia and other concentrated acids. Applied as 1% granules to water in which breeding occurs. Then methyl parathion, it is an organophosphorus compound. It's a synthetic contact insecticide. Then diazinon, it's a volatile liquid with the property of contact poison as well as fumigant action. It is effective in control of DDT resistant insects. Dosage is 60 to 100 milligram per square feet. Deltamethrin acts via ingestion and direct contact. So synthetic pyrethroid insecticide, it is 10 times more effective than naturally occurring pyrethrins. So again, these insecticides are classified into 3 types: contact poison, pyrethrum, DDT, HCH, and dieldrin. Then stomach poison, Paris green, sodium fluoride. Then fumigants, hydrogen cyanide, methyl bromide, sulfur bromide, carbon disulfate. Now we will discuss briefly about the insecticide resistance. The development of an ability in a strain of insects to tolerate doses of toxicants which would prove lethal to majority of individual in normal population of the same species. So factors associated with resistance. How are we able to develop resistance to the insecticide? Like the toxicant is converted into a non-toxicant form in the body of the insect by various enzymes. All these enzymatic changes are carried forward and transmitted through genes which may be single or multiple. So single gene resistance or multiple gene resistance. How can we manage the resistance developing to the insecticides? So rotation of effective insecticides with different modes of action reduces the risk of developing resistance to the insecticide. Then we will discuss about the MCQs and the vectors of public health importance. The motile zygote of Plasmodium is found in. Motile zygote is also called as eukaryote. It is found in the gut of the female Anopheles mosquito. So which of the following is a correct matching pair of disease and pathogen? Here it is filariasis and eukaryoria. Malaria is a disease and Anopheles is the vector, not the pathogen. Kala-azar is transmitted by sandfly. Yellow fever is transmitted by Aedes mosquito. If an infected person is bitten by a female Anopheles mosquito, what will it take up with its blood meal to become another infected mosquito for the spread of the disease? So infective stage for the mosquito is gametocytes of the Plasmodium. All of the following methods are anti-larval measures except malathion, because malathion is an insecticide. Aedes mosquito transmit the following diseases except Japanese encephalitis. Aedes aegypti transmit the following diseases. See, the options given are yellow fever, dengue fever, Japanese encephalitis, filariasis, and malaria. So, Aedes transmits yellow fever, dengue fever, and filariasis. The filariasis is transmitted by almost all the vectors like Anopheles, Aedes, Culex, and Monsonia. So, answer here will be the Japanese encephalitis and malaria. So, 3 and 4, except is 3 and 4, they will transmit yellow fever, dengue fever, and filariasis. Which of the following is not DDT resistance? Almost all the insecticides had developed resistance to DDT. Still, this phlebotomous species is still sensitive to DDT. So the answer is phlebotomous. All of the following are deliberate measures of mosquito control except deliberately we are controlling it, like use of larvicidal agents, community participation, and use of bed nets for mosquito. We are controlling. These are the control measures. So the use of alkaline soap water in the factory is not a control measure, deliberate control measure. Which of the following statements regarding DDT is false? Pyrethrum has synergistic action. We have came across this. It is a contact poison. It immediately kills the prey. Residual effect lasts up to 18 months. All these points were discussed previously. And most of the vectors developed resistance to DDT. So the answer will be, so the false statement here is immediately kills the prey. Not a feature of vector of malaria. So spotted wings will be present boat-shaped decks with lateral floats tressed at an angle inclined to the surface of the skin. The siphon tube will be seen in culex. So the answer here is culex, siphon tube. True about culex larva. It rests parallel to the surface water, long palmate hair and siphon tube present. What is the answer? Siphon tube present. Because the larva is at an inclined position to the water surface. True about mosquito preventive nets are all except hole size should be less than 0.0475 millimeter, 150 holes per square inch, and there should be no dent. Best pattern is a square, not circular. The answer will be 3. Which of the following viral infection is transmitted by a tick? So Kaiser forest disease is transmitted by soft tick and hard tick. Answer here is 3. Mineral oils are used in mosquito control measure as a larvicide. Mosquitoes that breed in dirty water collection are Culex. They are also called as Anopheles mosquito. They are found in the drainage canals, the septic tanks. Then match the following method of mosquito control exam. So biological control, it will be here Barbados millions fish. Then biological control by Bacillus thuringiensis. Environmental control is a source reduction. Chemical control is mosquito larvicidal oil. So the option here is A. A is 3. Chemical control. Mosquito larvicidal oil, chemical control. Bacillus thuringiensis is biological control 2. Source reduction is 4. Environmental control. And Barbados millions. So biological control. Answer here is 4. Example of cyclopropagative transmission is seen in malaria parasite in the mosquito. Best approach to the control of arthropods is environmental control. Then we will discuss about the MCQs and the insecticides also. DDT stands for dichloro, diphenyl, trichloroethane. Option is D. First organic pesticide to be used commercially was DDT. The chemical present in flit or finite is malathion. DDT concentration increases in human body because it is soluble in fat. Option here is C. Carbamates employed as insecticides are propoxer. Option is C. DDT is a organochlorine. Option is C. Bagon contains propoxer. Which one is not matched? Here organochlorine is DDT, organophosphate is malathion, and carbamate is carbofuran. But pyrethroid, it's azadirachtin, not atrazine. Pyrethroid, okay. Pyrethroid are the synthetic compounds. It is the wrong option. Pyrethroid, atrazine. Option is C. Which one is the rodenticide? Zinc phosphide. All of the following are contact poison except pyrethrum, DDT, Paris green, dieldrin. Here the answer is Paris green because it is a stomach poison. Mechanism of action of malathion. It is an organophosphate compound, inhibits the enzyme acetylcholinesterase. Under the insecticide treated bed nets program, insecticide used is deltamethrin. Option is D. The essential ingredient in the sprays for vector control is the sprays which we use frequently in our homes. It is pyrethrum. What is the size of an ideal mosquito net? We have already discussed this. It is 0.0475 millimeter in any dimension. Option is B. The following are all residual insecticides except they don't have residual action. Pyrethrum. Option is A. Which of the following insecticide is a natural product? Pyrethrum. Option is B. Identify this vector control tool. It's a vector trap. Mosquitoes come in contact to this trap and are killed by the insecticide inside it. Number of holes in mosquito net is. Option here is 150 per square inch. Answer. Answer is A. All of the following methods are anti-larval measures except malathion. We have already discussed it. Malathion is an insecticide. Option is D. So again, the match the following method. Here the correct is mosquito larvicidal oil is a chemical control. Bacillus thuringiensis is biological control. Source reduction is done by environmental control. Barbados millions is a biological control. Answer is option 4. Insecticide used in fogging and the time period usually fogging operations are carried out. So synthetic pyrethroids are used in fogging and the time usually carried out is 4:30, 5:30 a.m. to 7:30 a.m. or between 4:30 p.m. to 6:30 p.m. Because our vectors are active. Vectors responsible for dengue or malaria are active at this time. It correlates with the biting time of the vector. So the fogging is done this time. Thank you.